This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Greetings. My name is Dr. Rob Page, and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its members to give information to patients to provide them with additional information they can use in terms of seeking therapy or additional information that they can have prior to going to seeing a physician. And I'm very pleased to have here with me today Dr. Carly Fowler. Welcome, Dr. Fowler.
Thank you.
Dr.
Thanks for having me.
Well, thank you so much for coming. Otherwise, I'd be sitting here by myself, which I'm not very interesting. So, I mean, thank goodness you're here. But Dr. Fowler is a dermatologist here in the city of Knoxville. And today she is here to talk to us about, I think, a topic that's very important to at least someone like me. And I think that is actually as important to a lot of people, and that's hair loss. So what general information can you tell us about? Now we know about men and losing their hair, but what other general information can you tell us about hair loss?
So the medical term for hair loss is alopecia. And so in general, I have a lot of patients who come to me and they say, I have alopecia, and they think that's a diagnosis. What people don't know is that there are so many types of alopecia. So there are a lot of different types of hair loss, and it's super important to figure out which type you have so that you can target your treatment toward which type you have.
So now, are there different types of alopecia that generally affect different age groups, or are there, the one type that we're all familiar with is, male pattern baldness. I mean, that to me would be the most common type. But are there forms of alopecia, different forms of alopecia that affect younger people or older people or females? And what types are those?
So there are a lot of different types. It's really best to kind of group them. Okay. So I like to group them in two different ways, really. But the first way is inflammatory hair loss and non-inflammatory hair loss.
And what is inflammatory?
So inflammatory means your immune system has kind of gotten revved up or excited, and the immune system is attacking the hair follicle in some way. And so as far as types of inflammatory hair loss, lupus would be one that probably a lot of people have talked about. There's a lot of different types of lupus too, but certain types of lupus can cause hair loss. Alopecia areata is one type that's fairly common, particularly in kids, where patients get like little bald patches. So that's another inflammatory type of hair loss. And then the third inflammatory type that I think about a lot is one called lichen planopilaris. And that is becoming more and more common. It's a newer diagnosis, so a lot of people haven't heard about it, but it's becoming incredibly common.
Now you say lichen planopilaris. What are some of the features that you look for? Let me back up just a little bit. So you have a patient who comes to you. So first of all, I guess I should even back up a little bit further. If I'm starting to lose my hair and I'm a younger person, I shouldn't just basically say, well, I'm starting to lose my hair. I should come see you.
Yeah, absolutely.
I should come see you because as you mentioned, there are different types of alopecia.
Yes.
And there are alopecias and they have different types of treatment. So you mentioned these types of inflammatory alopecias. And are there some alopecias that don't involve inflammation or even maybe some that could involve an infection?
So there's inflammatory hair loss like we talked about, and then there's non-inflammatory hair loss.
Okay.
Non-inflammatory hair loss is more like hormonal. So that's where you talk about like male pattern baldness. Females also have a female pattern baldness. So those don't involve the immune system. They more involve a shift in hormones that's caused the hair loss. And
not all these alopecias are like a permanent type, basically a permanent type process. A lot of times they can be very temporary.
Yes.
We talk about women in pregnancy hair.
Yes, so that's something called telogen effluvium. That's a non-inflammatory type of hair loss, and that is completely reversible. So what happens is the hair, about 3 months after, say, having a baby or an infection or a hospitalization or something really stressful, COVID, for example, some sort of stressful event, the hair shifts into what we call telogen phase.
Gotcha.
And telogen phase is the resting phase. And when the hair shifts into the resting phase, it kind of it kind of starts falling out in large clumps. So patients will come and they say, "Oh, my hair's falling out in clumps." And the great thing about telogen, that's called telogen effluvium. The great thing about that is it's reversible.
Oh, that's awesome. So well, you mentioned all these different types of alopecia. So if I come to you as a patient and I say, "Hey, what kind of alopecia do I have?" What do you generally do? I mean, is this something you just look at the patient and you say, "Oh, well, I can tell by, the way the hair is, out of your head, or the way your skin looks, what type you have." What generally do you do to try and evaluate these types of alopecia?
So I generally like to schedule a separate appointment for hair loss than for other issues because there's a lot that's involved in it. And so a hair loss visit always starts with a questionnaire. So patients get a 2-page questionnaire asking about all different types of things, whether they've had stress or an illness recently, how they style their hair, what they do as far as treatments to their hair, whether they're doing any permanents or relaxers or anything like that. And medications also can play a role. So there's a hair loss questionnaire that we start with. Then, I review the questionnaire, I talk with the patient, kind of talk about some of the issues that they're having, and then I do the physical exam, which means looking at their scalp. Not only am I looking with my naked eye, I'm looking with something called dermoscopy, which is a little special polarized light that kind of lets me look a little deeper in the skin. And that can tell me whether there's inflammation around the hair follicle or scale, meaning dead skin buildup. So that can kind of give us some clues too.
And then, and even beyond that, there are other procedures that you can do to evaluate the hair loss.
Yeah, so a lot of times we'll do a biopsy. And the biopsy really lets, a pathologist reads the biopsy.
Someone like me.
Someone like you. An excellent pathologist will read the biopsy. And the pathologist can sometimes see inflammation before I can see it with my naked eye, before the patient can detect it. So the biopsy can be super important in determining the type of hair loss too. We'll also sometimes do a hair pull test. That's something I tend to do if I'm suspicious of that telogen effluvium, that cyclical pattern of hair loss. And labs. So with labs, we're looking at thyroid, iron stores, sometimes hormones, depending on, the patient and what they're experiencing too.
So intrinsically, hair loss is not just one thing that happens. It can be a multitude of factors that are actually causing this. And so it's important to get a very extensive evaluation, as you mentioned, knowing your medications, knowing what your blood work shows, doing a physical exam, and even doing a biopsy sometimes. So let's say you've done a biopsy and you come back with a certain result. Are there different treatments that you generally use for these different types of alopecia?
Absolutely. So it kind of depends on the type.
Okay.
Let's take lichen planopilaris, for example. So lichen planopilaris is one of those inflammatory, we call it LPP for short. So it's inflammation at the base of the hair follicle. So a lot of times we'll use anti-inflammatory medications to treat it. So topical steroids, like in liquid form, sometimes even immunosuppressants or immunomodulators to kind of, your immune system's revved up in this condition, so we're bringing it down a notch. And then sometimes injections of steroids, even antibiotics can be anti-inflammatory and help with that too. So there's a lot of different treatments for it. The big thing with that type of hair loss is catching it early.
Gotcha.
Because there's two more different types of categories of hair loss. There's scarring hair loss and there's non-scarring hair loss. And what happens if the inflammation is left there long enough, the hair is kind of pushed out of the hair follicle and the skin scars over, so there's no hair follicle left. And once that happens, it's really hard to grow hair again.
Gotcha. So if you let this go on for a long time, and if you don't seek a medical opinion or don't get any therapies for it, so if you're saying, oh well, I anticipate it might get better, you're actually getting to a point where there's not much you can do about it. So it is important to get evaluated for these things fairly early.
Yes, absolutely.
Now what about you mentioned hormones? Now what role do hormones play? Because I know they play a large role in someone like me. But
They play a large role in all of us, Dr. Page.
but what about females? I was going to say, now are there do females get the same type of hair loss that males get?
Yeah, so female pattern alopecia is actually very similar to males. It just tends to happen in different areas of the scalp.
And what sort of treatments? Now, are there treatments that you can offer for females in that regard as well?
Absolutely. So female and male pattern hair loss are actually treated somewhat similarly. In females, we can use a medication called spironolactone that can help grow hair. It more tweaks the hormones. And in males, we can use a medication called finasteride, which is also known as Propecia. And so that tweaks hormones too. And then both can benefit from topical treatments like Rogaine, that's over the counter.
Right.
There's female Rogaine, male Rogaine.
Now, what's the difference between the female? Because I've seen that. I've seen that. It's just the strength. So,
yeah. So the female tends to be like 2.5%, and the male tends to be 5%. So basically, all my patients are recommended to get the male because
right. I was
really
going to say because you would generally want more. But I've always wondered about that because one is pink and one's blue.
Yeah.
And so you wonder
They're
if
probably cost different too.
But intrinsically, there's no difference in the medication. It just has to do with how strong it is.
Yep.
So there's twice as much medicine.
Yeah.
It's a twicer strength. More potent strength in the men than it is
Yeah.
for the females. But that's something. But there's no differences otherwise. You could use it both in the same groups. Now, are there any situations in which you would not want to treat a woman with Rogaine?
Not that I can think of.
Are there? Well, I mean, I'm wondering about if you're childbearing years.
Yeah, sorry,
yeah.
yes. So a female of childbearing age wouldn't really want to use.
Gotcha. So this is not
sorry.
something. Well,
more of a female who's pregnant or
gotcha.
Who's breastfeeding. So females of childbearing age can use Rogaine.
But what women? Oh well, I said childbearing. I said mainly women who are pregnant.
Yes.
Because that's not something you want to be taking when you're pregnant.
No, but a lot of these treatments are not things you would want to do if you're pregnant. So.
Gotcha. Okay.
Yeah.
And notwithstanding, there are a lot of other factors that are involved during pregnancy, which can actually cause hair loss as well.
Absolutely.
So
shift in nutrients.
So, well, you talk about the different types of alopecia. You talk about the scarring and the non-scarring. You talk about basically the different therapies that can be used for each. Are there any other therapies that are out there that we could use for hair loss?
So a kind of a newer treatment is something called Platelet-Rich Plasma PRP. And so that's really interesting. There's a lot of talk in skin and hair about growth factors and growth factors helping renew the skin as far as anti-aging. So this is basically taking your own growth factors and injecting them into your scalp. So basically what we do is we do a blood draw. We spin the blood down. The platelets get activated, and then we take off the platelet pore plasma, so the kind of clear straw. Stuff at the top, and then you get this plasma that's really rich in growth factors, and it gets injected into the scalp.
And this is something you do in your office?
Yeah,
oh, wow.
absolutely.
Oh, wow.
Yeah. It's about 3 treatments, so once a month for 3 months, and it can make a huge difference.
Now, is this something you can use for any type of hair loss or any type of alopecia?
So it's approved for the hormonal patterns of alopecia. However, there are some studies looking at it in other types as well, like lichen planopilaris. It's been kind of recently studied for that.
So not only for the non-scarring, which mentions more some of the hormone-driven alopecias, but also for the scarring ones. It can actually, as you mentioned, some early studies, but not really much known at this point about whether or not that makes it better. So.
But a lot of the times patients are so bothered by hair loss and they're so concerned with it that they're kind of willing to try whatever it takes because it's something that has such a huge impact on their lives.
Now you've dovetailed perfectly into what I was going to ask next, and that's about a lot of these treatments that I see. One of the ones that I see all over the place now is this laser comb. The laser brush, the laser comb. Is that of any utility? Is that something I can use? Is it going to help me grow my hair back?
Well, for you, I don't know. I'm just kidding. So a lot of people are using the lasers these days, and there are even like helmets that you can get at home and use at home. And there is some good evidence for those. I've not tried them in my patients or on myself, but I think it's worth trying. One thing about hair loss that's super important is you don't want to just stick with one treatment. You kind of want to use a couple different treatments together to really kind of kickstart the hair follicle into growing.
Gotcha. And the other important thing you told us about is that there's not just one type of hair loss. So if I'm losing my hair, I'm not just going to go out and buy this comb and imagine to myself that it's going to instantly make things better, because a lot of it depends on what type of alopecia I have, and and whether or not it's actually going to get better or not.
Right.
So you've given us a lot of good information about alopecia. Any myths you'd like to share with us about hair loss? Any things that and anything you can tell us that can help hair loss, or can hurt hair loss that's out there that we don't necessarily know about? Or
I think one thing that's important is patience with hair loss. So hair doesn't grow overnight. Hair growth is a very slow process. So you've really got to give it time to let the treatments work.
And so therefore, this is not something that we come in and get an instant gratification on. That we come in, one of the reasons why you do such a very thorough history with the patient is you have to make sure and get a lot of information so that you can therefore take a very careful, and sometimes even many different approaches to how you approach these patients. So but not something so if we're losing our hair, we don't need to immediately say, oh, I need to go buy a wig, or oh, I need to immediately go get hair transplant. That there are medical ways, and it probably is important to go see a dermatologist to figure out exactly what type of alopecia we have before we start seeking therapies on our own, or even going into cosmetic treatments like hair transplant and things like that.
Absolutely. Yeah, dermatologists have a lot of training in hair, so I don't think that people always recognize that a lot goes into that.
Gotcha. Well, excellent. Well, you've given us a lot of awesome information about hair loss today, none of which has been helpful to me at all. But
well, we can always try that PRP.
I know. I'm just thinking about, but you've given us the information about PRP, what you do in your office, and you're not new to the Knoxville area, but you have a new office here in town. Would you give us some information about that?
Yeah. So my husband, Dr. Daniel Fowler, and I started our own practice about 2 years ago now. It's called the Knoxville Center for Dermatology and Plastic Surgery. He does plastic, reconstructive, and hand surgery, and I am obviously a dermatologist. And our office is at 4319 Paper Mill Drive, and our website is www.knoxdermplastics.com, and you can look us up on social media at knoxdermplastics.
So you got all sorts of resources. So on your website, do you have information about types of hair loss, or information about what types of things that I should come see you about?
Absolutely.
Perfect.
Yeah.
So, and not only that, but your phone number and how to get in touch with you, and maybe get in touch with your husband. One-stop shop. Go in, cure your hair loss, and then basically get some cosmetic surgery and basically spice yourself all up. So, Dr. Fowler, thank you so much for joining us here today.
Thanks for having me.
Very much enjoyed it. So, and with that concludes this episode of Doc Talk. Doc Talk is a series of podcasts that is produced by the Knoxville Academy of Medicine, which features its members giving information to patients about topics of interest to them. And with that, I'd like to say goodbye.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.